Dr. Charles Shidlofsky. I'm in Plano, Texas. I'm the current president of the Neuro-Optometric Rehabilitation Association. And DeAnn is a wonderful past president of the same association. I've been involved in neuro-optometry for a good part, probably the last 20 years, working with traumatic and acquired brain injury patients, neurological injuries, things of that nature. But I'm also a founder and past president of the International Sports Vision Association. And that organization works a lot with athletes. I think really what happened was as we continue to evolve our protocols in the neuro-optometric world, I had the opportunity to attend a meeting with DeAnn last year and was introduced to Vielight technology, and she told me all about it. And when I got back, I purchased one, and we've been using it in our clinic ever since very successfully. So I'll let DeAnn take it from here.
Thanks, Charles. Well, I certainly appreciate this opportunity. And first of all, Vielight, thank you. In my email, if there's any questions, you can certainly contact me personally. I answer everything there is. We do have a website out that gives some education as well. And I do have a book on foundations of neuro-optometric rehab on Amazon, and you're welcome to take a look at that. I think the biggest thing that led me down this path is that why does one person recover from their injury and the other person does not? You can have two people that have identical injuries to their head. They can have the same symptoms, and one can fully recover and the other one does not. And so it got me looking at different kinds of things for these persistent symptoms lie in the inability of that person to recover. So I began looking more closely at what things I could add to my therapies to help fix the repair process for these folks to be able to get better faster. So in fixing that repair process first, we had to look at if we didn't properly do that, then pushing an intensive rehab like vision rehab or vestibular or cognition could backfire. And that's why so many patients have a leading increase in, say, fatigue, dizziness, headaches, and they get a regression. And so we had to start looking at how could we stabilize the nervous system, and what would that stabilizing mean? We had to reduce inflammation. We had to take a look at that mitochondrial function. And so we wanted to make sure that the brain could get into a better state. So the first thing that I started looking at is how can we support and optimize that brain's repair process before we started any type of intense therapy. And so by looking at the energy availability or inflammation control or talking about neuroplasticity, we had to really get down to autonomic nervous system disorder. So in my patients, I was seeing a lot of autonomic disorder or a lot of autonomic dysregulation after a concussion or traumatic brain injury. So without these foundations, the rehab efforts that we were doing would become ineffective. And so came across Vielight, and because of that photobiomodulation, started using it on some patients to see whether or not I could get the patient to respond a little bit quicker, better, faster to any type of therapy that we did. So Vielight, of course, supports this stimulation of the cellular energy production. It looks at reducing that inflammation, and it supports that neuronal connectin. So when we look at energy availability, we're really looking at that ATP production. And for us, we need to have that for the visual and the vestibular pathways to have that energy to be able to rehab them. And so what we discovered, at least I do a lot of concussion work, is we found that by starting out with, say, photobiomodulation, we could find that they could accelerate their recovery from their concussion. Literally, I would have patients come in with grass stains on their knees from a sports injury, and we could begin doing a particular therapy of photobiomodulation or syntonics in order to upgrade that brain energy deficit and to get those visual processes going. Charles?
I think you made a point at the very beginning. You said you have a situation where you have two patients, dental injury, yet their recovery process is different. And that really brings us to the concept of inflammation, because neuroinflammation is really the driving force behind that. And what controls inflammation? And I think we have to understand that there is a genetic predisposition with inflammation that we have to think about. So some people turn on inflammation rather fast. Some people can't turn off inflammation. So if you want to think about it, think of the person who gets a mosquito bite. One person gets a small little welt, and this other person, their arm blows up really big, right? The same mosquito bite, but once again, two different responses. So obviously how an individual deals with inflammation is why people recover at different rates. So now that we have that understanding, where does Vielight come into this whole process? And where it comes into the process is it's anti-inflammatory effects. And it's going to reduce neuroinflammation in the optic pathways, the cranial nerves, the brainstem. Remember, don't forget, the eye itself is derived from fetal tissue, from brain fetal tissue, that is. And so really it's an extension of the brain, if you want to think of it that way. And so when we start affecting the brain using the red light from the Vielight, that's where you're going to get that reduction in neuroinflammation from that process. And then, of course, when we have the visual vestibular integration, you're going to reduce visual stress. We're going to reduce visual fatigue, decrease sensitivity to light. And obviously, these are things that are seen very, very commonly in post-concussion vision disorders. So I think these are some of the important information that we have to understand. And what drives a lot of this whole concept is what we call neuroplasticity. 25 years ago, no one really knew what neuroplasticity was. Everything was thought to be in a linear fashion with the brain. And then we discovered, 25, 30 years ago, that really the brain acted like we were trying to create artificial intelligence by creating neural networks. So when you have these neural networks that take place, that how those networks arrange and fix themselves is really what neuroplasticity is about. So when we use a device like Vielight, what we're doing is stimulating those brain-derived neurotrophic factors and enhance synaptic plasticity. So when we start doing that and we're getting changes in the brain, okay, we're changing the neural function, we're making new connections. So we're restoring, and by doing that, we're restoring oculomotor function. We can smooth out oculomotor skills. We reestablish saccadic control and smooth pursuit control. And then also, because obviously if we're restoring oculomotor function, we're also going to aid in convergence and accommodation. So our ability to converge and diverge our eyes, because one of the biggest things we see in neurologic injury is convergence insufficiency. So if we can, once again, as we start fixing these things, as this neuroplasticity comes into play, convergence and accommodation are functions that get better. And then once again, the cortex has an opportunity to reorganize that way. And so it creates adaptations, and that can help things like visual field defects. Visual attentive defects also can be improved when we have this cortical reorganization. Then the next thing is we talk about autonomic regulation. Okay, and in autonomic regulation, the Vielight is really helping us shift that autonomic nervous system toward parasympathetic dominance. Let's think about that. When you have a person who's had a neurologic injury, typically what will happen is their sympathetic system will go into overdrive. Okay, and their pupils will get large, which also makes them more light sensitive, but that's part of the problem. But the heart rate changes, things like that. All these things are happening when you have a neurologic injury such as a concussion. However, what Vielight does is it kind of pushes over to the parasympathetic side, and reduces that sympathetic overaction. And it's going to change the way we deal with vision motion sensitivity as well. Okay, people who had concussions, for example, have a lot of sensitivity to motion, and this will quiet that sensitivity down. Another big problem we see is dizziness, and with dizziness, dizzy patients are some of the most challenging patients there are, because their lives, it affects every aspect of their lives. So it's important to think about how can we modify and decrease dizziness effects that affect these patients, and certainly by creating autonomic regulation, you're going to stabilize the dizziness and make them feel a lot better. And the same thing can be said for headaches as well, because headaches are also another big problem we have with neurologic injuries. And certainly if we can decrease the frequency of headaches, decrease the severity of headaches, it makes a huge difference on the patient's daily activities of daily living. So a lot of times what we'll do is we'll start out and maybe do a couple sessions before they even start therapy, just to kind of get that regulation in place. And then we actually have our patients wearing it while they're doing vision rehab in our office. So we'll have them set up with the device on. They may do, like synaptic sensory station. They may do, a light board of some sort. They may do other activities while doing that. So it could be very, very helpful and handled at the same time as neurovision rehabilitation. But obviously, when we do neurovision rehabilitation, we're also treating the vestibular system. So in vestibular rehab, it can be very beneficial. And then obviously, the vision system rarely acts alone. Okay, it has its cohorts, and its cohorts are the other senses of our body. And so one of the most important things that I always talk about is you have three basic foundational elements. You have auditory, you have vision, and you have sensory motor. And we have to integrate those things in order to be able to learn properly. And so what this allows us to do is have that multisensory integration to start occurring more readily, more rapidly. So why does this matter? Well, certainly it's going to enhance neurovision rehabilitation. Okay. It's going to make us more effective at doing what we do on a regular basis. And when we're doing what we say is optimize key neurological functions, support energy production, inflammation control, neuroplasticity, autonomic regulation. Those are all things that we're trying to optimize. I think also what happens sometimes is there are other things that may be affected by this as well. Things like autophagy may be affected by this as well, because it makes our cells actually more efficient. So it allows the autophagy to take place more effectively and more efficiently. It improves that visual motor integration. Once again, we talked about it before, that ocular motor control, improved visual attention, improved visual spatial skills. DeAnn and I talk about it all the time. What's important, obviously, the vision system has to answer three questions for us every day. What is it we're seeing? Where is it in space? And lastly, where am I in space? And the truth is that third question is the big bugaboo. Because when people have a concussion and they go into sympathetic overload, they collapse space and become hyperfocalized. And what we're doing here by opening up and allowing this better control, and it's actually opening up our visual attentive zones so we can process information more efficiently and more effectively. The next thing on here is boost balance and coordination. Certainly that plays a role in this. So aiding in vestibular function, postural stability. And I balance test virtually all of my patients. And I can tell you that we've done balance testing, and then we'll put the Vielight on, do a couple sessions of Vielight, and I'll rebalance test them, and we can see a change in their overall balance. So it really does make an impact on it. Lastly, accelerates cognitive and functional recovery. Certainly, as our brain becomes more efficient, it allows the cognition system to ramp up a little bit and get improved. So typically, when we do this combined with a neurovision rehabilitation program, we always tend to see an improvement in cognitive abilities. So Vielight supporting neurovision rehabilitation. So we're optimizing that eye-brain connection for post-concussion recovery, stroke rehabilitation, neurodegeneration support. Even things like Lyme disease, things like some of these other disorders like Parkinson's syndrome, things of that nature. Those are some things that could certainly benefit by Vielight therapy. And once again, the whole idea of it is to decrease neuroinflammation to accelerate recovery. That's kind of how I always look at it. Anything I can do to decrease that neuroinflammation is going to allow for recovery. And I'll add something to this also, because I did some studies on visual snow syndrome, and we're using it with our visual snow patients a lot, because what we're doing with it is we're, once again, making the system more efficient, decreasing that stimulation of that sympathetic nervous system, and it's allowing them to heal quicker and not feel the effect of the visual snow on their system as readily and as really affecting their lives in such a dramatic way. But going back to concussion, go back one there real quick. Going back to concussion, light sensitivity. Once again, it reduces neurogenic inflammation, regulates autonomic function, decreases photophobia and visual discomfort. And once again, for stroke and visual field recovery, we're getting better perfusion, oxygen perfusion of the brain, which is going to reawake some of those areas that are only partially functioning. And once again, supporting neuroplasticity is really what this is all about. So how Vielight supports eye-brain connection and recovery from neurologic disorders. And there we put in visual snow syndrome. We've definitely seen some major benefits with it. Lyme disease, vitamin deficiencies, connective tissue disorders. One of the more interesting vitamin deficiencies I've worked with, I've had about 5 beriberi patients, which is vitamin B1 deficiencies, and they have a lot of neurological symptoms related to it. It's the associated disorder to the beriberi that causes the neurologic issues, and we've seen some benefits in using things like Vielight technology with it. Long COVID and post-viral syndromes, and even not only long COVID, but vaccine-related neurological dysfunction. During COVID, we not only saw this hyper neuroinflammation that was related to the COVID, but we were also seeing inflammation related to vaccine injury. It can go both ways in that respect. And then other neuroimmune and inflammatory conditions, certainly anything that creates inflammation and anything that creates neuroinflammation can be manipulated, certainly by using Vielight technology. So this photobiomodulation reduces that neuroinflammation, supports the neuroplasticity, and restores that autonomic balance. And that's where it's most powerful.
So as Charles was talking about the autonomic nervous system, for me, if the simplest way to think about it is the sympathetic system's always on. And if we use heart rate variability or something to be able to judge how our autonomic nervous system is functioning, often we find that we have too much sympathetic and not enough parasympathetic, which indicates that perhaps the brain is not working as well as it should, because the parasympathetic system and the vagus nerve tend to be more tempering or more controlling of that sympathetic system. So when we realize that through vagus nerve and heart rate variability, that we can regulate that autonomic tone and we can get that vagus nerve stimulation, we can better work with those patients because we're able to facilitate the oscillation or the movement in between parasympathetic and sympathetic system to be more of a flow. And so by having that nervous system being regulated, we have less visual fatigue. And so oftentimes it'll improve the pupil light response. It'll improve the fact that we have a saccadic latency, and it helps with that eye strain that's post-concussion. And so we integrate the Vielight with a lot of our multi-sensory therapies where we might use PMF, which is a pulse electromagnetic field. We use a lot of frequency. 95% of our body is frequency and about 5% is chemical. So by using Vielight and using some of these other types of products together, we're able to help with that neuro rehab and enhance that multimodal therapy approach, and it gives us a better recovery and performance. And so one of the things that we find is absolutely by using Vielight in conjunction with any type of eye-hand coordination, we might put them on the synaptic and use eye-hand coordination to enhance that attention, that visual processing. And what we get is we get an improvement in reaction time. And for my concussion patients, that is one way for me to know whether or not that concussion patient is healing, is whether or not their reaction time is getting better. So we use this for a lot of our sports and performance optimization. And so when these patients come in or these individuals come in and they want to perform better, we'll be using the Vielight product along with using any type of eye-hand coordination, or maybe we're going to do vibration. So in conjunction with those types of things, we're able to get them to a higher visual motor performance. And then certainly for kids and adults that come in that are having concerns about processing speed or their ocular motor control, the Vielight helmet really helps getting that word fluency and supporting that reading ability. So definitely, I was mentioning before that of all the Vielight devices that are out there, we find a place in our clinic for each and every one of them. Probably our go-to device is the Vielight Neuro Duo, and oftentimes we're able to use that 40 hertz stimulation. We use that probably the most, but we also combine that later on in the afternoon for patients at 10 hertz. And so what happens is I'm trying to get that patient to get that autonomic nervous system regulation to be able to go in and out of flux. So we might use the Vielight in conjunction with hyper-ice compression boots. And what we find is that it helps with headaches and it helps with concussion recovery. The other product that we use a lot is the Vielight Vegas product. And that's been very helpful in my patients in helping them getting to sleep better. One of the challenges of any type of traumatic brain injury, concussion, stroke, neurodegenerative disease is whether or not they're appropriately sleeping. And so by using the Vegas apparatus stimulation, we're able to enhance that parasympathetic stimulation and that activation, and we're able to get their heart rate variability to be more regulated. And so as a result, we get a better control or a better reduction of dysfunction of that autonomic nervous system. So we're going to start out with a case one. I see a lot of concussions, and we've been very fortunate to be doing this since 2010. So we have a lot of different types of information that comes in. I have 1,400 kids from the Metro Youth Football that come see me when they have a concussion. So they'll literally show up in my office with grass stains on their knees. This one happens to be a 32-year-old female who was playing soccer. And what happened is she took a soccer ball to the chin, which drove her head back. She had light sensitivity, blurred vision. She had difficulty reading and using screen time. She had headaches and dizziness with eye movements, and she couldn't sleep. She had poor sleep. She was waking up every 2 to 3 hours. So our intervention at first, literally off the field, is that we did Vielight Gamma daily use for her. And how we do it was we do a matrix. That patient may come in and see us every day or every other day, particularly if it's a concussion patient, because they need more care. So if we saw them, say, between 8 and, say, 1 o'clock, we would use the gamma daily use for that support. If we saw them 2 o'clock and after, we would use the alpha in order to calm that system down. And oftentimes what we would do is use it in conjunction with eye movements, using those eye movements outside of 18 inches so that we would not be stimulating that third nerve as much. And then we would use it in conjunction with either PMF or vestibular rehab. And once again, binocular tracking and strobe would do a lot better. So what happens is the outcome is 3 weeks. We reduced the headaches and improved her light tolerance. In 6 weeks, she was back to reading and doing screen time. And within 10 weeks, she was back to a full return in work and sports activity. Now, once again, it wasn't only the Vielight that we were using. We did it in conjunction with other concussion management programs. But at the same point in time, that is a quick return for most soccer players. So the concussion management for us is to use Vielight Gamma 20 to 25 minutes a day, because that enhances that neuroplasticity and supports that cognitive recovery. Then we have light sensitivity and visual motion sensitivity. So the Vielight Alpha we use, like I said, in the afternoon for evening to help support sleep. We have, once again, some sleep aid stuff that we'll talk about, like melatonin, or maybe they'll use a different kind of product like Brain Tap or Mind Alive to help relax that system. We also use Vergence and saccadic training. And then, of course, we use some classical types of things like binasal occlusion, yoked prism, and we do gaze stabilization. Charles?
Okay, our second patient here is a Parkinson's patient. As we mentioned earlier, Parkinson's, TBI, stroke, all in the wheelhouse of this. So this was a 68-year-old man who had Parkinson's disease that was diagnosed 4 years previous. And what the symptoms you have here, these are some of the real common symptoms we see in Parkinson's: reduced contrast sensitivity, freezing of gait associated with visual input, uh, cognitive fog, or sometimes we call it brain fog, eye strain, impaired balance and spatial awareness. So those are really, really common things that we see across the board in our Parkinson's patients. In the intervention side of things, we used the Vielight Neuro Duo, which was the gamma and the alpha for cognitive function. And once again, as DeAnn mentioned, we'll do it on a matrix, depending on time of day, things of that nature. We can use prism lenses to improve spatial awareness. So in this case, we'll use a lot of yoke prisms. Typically vertical yoke prisms, low powered, 1 to 3 prism diopters, can make a huge difference for these patients in their perception of space, knowing where they are in space. And then some sensory integration therapy, and that's where we integrate vision system, proprioceptive and vestibular. One of the things I like to do here is I have on my platform posturography, I have some activities, some games that they can play by shifting their balance by utilizing a visual cue. And it really works really nicely to integrate that vision and proprioceptive and vestibular all together. But there are many other activities that you can use as well. The eye-hand coordination activities. This is where the synaptic sensory station is really good. The Sanavision integrator can be very good. There's, we still have the old saccadic fixator, can be really helpful with that. Fit lights, just to name a few, can be very helpful in these situations. And then certainly gait training with visual cues. Once again, having them walk and watching them walk, using some yoke prisms with walk, things of that nature can be very helpful. But we have to get them to do this to minimize those freezing episodes. So ultimately, when we completed after 4 weeks, we noticed improved visual tracking and reduced cognitive fatigue. And that's a huge step forward for them, even at this short time period, because once again, we're improving energy. So they're able to sustain more throughout the day even at that 4-week time period. And then we hit 8 weeks and they had enhanced balance and fewer freezing episodes. Once again, further improving balance, further improving their quality of life. And at 12 weeks, increased contrast sensitivity and smoother gait. So getting them back to a much more functional life is really what this is all about. And that's kind of how we utilize this. So getting back to the traumatic rehab, once again, using the Vielight Neuro Duo, both with the gamma and the alpha, alternating its daily use. Gamma, once again, for cognitive clarity, memory, and reaction time. Alpha for autonomic nervous system balance, like reducing anxiety, improving sleep. The X Plus system now, which for systemic support, 20 minutes a day. And what that does, it enhances that whole body neurovascular circulation. And that's so important. Once again, enhancing blood flow is going to enhance brain function. It's going to support the cells. It's going to decrease neuroinflammation ultimately as well. And then, of course, pairing it with our Neuro-Vision rehab. We can do some contrast sensitivity training, dynamic vision exercise with vestibular stimulation to retrain balance and coordination. I do a lot of visual spatial activities to continue to enhance those visual spatial skills. Ocular motor control. Once again, that's really what this therapy is really working with, and this is why it matches so beautifully with what we do in what the Vielight does with Neuro-Vision rehab. It's just a natural sense of improvement for that. Last case here, I think it's the last case, chronic visual fatigue and using the Vielight. We had a 45-year-old male IT professional. Digital eye strain. How often do we hear this? You have that early presbyopic patient. They're just maybe needing their first reading correction in their lifetime. But you get those people that are spending 10 hours plus hours on the screen every day. Then they come home and play video games with their kids, so they're really, really pushing it as far as that goes. They're getting blurry and double vision after prolonged near work, a lot of neck pain and tension headaches, a lot of visual fatigue and really overall fatigue, and difficulty maintaining focus. And then he had some complaints of visual snow as well. Interesting enough, on visual snow, it's considered a very, very rare syndrome, or it has been considered a very rare syndrome. And now it's thought to be possible in up to 2% of the population. And when I think about it, you say 2% of, oh, that's not a high percentage, but 2% of the population is a lot of people. Even if it was one half of 1%, that's a lot of people that are affected by it. But some people, it doesn't affect their lives on a daily basis, yet they still see it. But they never heard it described before. And now people it's becoming more in the mainstream, and people are starting to understand it better. So people are saying, yeah, that's what I see. I didn't really realize what it was. And so visual snow is really something that we can certainly enhance, as I mentioned earlier, with utilizing of the Vielight. So we use Vielight Alpha to reduce the neurofatigue and support relaxation. We also, it's very important when you have a person who's on a computer screen all day long, to modify that. I think first thing that I think is the posture adjustments. Make sure they're aimed in the right place. Their eyes should be pointed 15 degrees downward for optimal for the optimal way for the eyes to perform. Don't forget, if their eyes are wide, if they're looking in the middle of the screen, their eyes are wide open, and their eyes are becoming drier too. So dry eye can play a role in this too. But using blue light filters, especially in the evening, can be very helpful, especially to improve sleep. Lighting optimization, having the right lighting, indirect lighting tends to work really, really well for these individuals as well. Doing some saccadic convergence therapy for near to far visual endurance. Once again, we definitely need to continue, if they're getting fatigued, we have to work on things to improve that endurance. And those are some activities that could be beneficial for them. Cervical spine therapy to address posture related strain. Remember, this patient had a lot of neck strain. And once again, if their head is in a bad position when they're looking at the computer, remember, the eyes lead the body, right? So if you think about that, if their head's in a weird position because their eyes are not set right, it's going to cause a lot of cervical spine pain and neck pain. So doing some spine therapy can be really, really helpful for these patients. Hydration. I don't think we have to say much more than that. Everyone needs to drink more water than we do. I'm one of them too. I get busy in my day and I stop drinking water, and then at the end of the day, it's like, oh my goodness, I need to drink more water. So hydration becomes very important. Obviously, support the autonomic nervous system. We want to drive that parasympathetic, get them out of that fight or flight response. So we always go back to the classics here: hydration, diet, sleep, and supplements. So the outcome for this gentleman was after 2 weeks, we had a reduction in daily headaches, improved posture awareness. 6 weeks, we had improved near-far focus ability, endurance, and reduced digital eye strain. At 10 weeks, he's able to sustain visual performance for longer time periods and optimize his work ability. And guess what happens when you optimize work ability and work habits? What ends up happening is the productivity gets better. And guess what? Your employer tends to like higher productivity. So it allows them to perform better at their job. So for chronic fatigue and overload, once again, just to sum it up, Vielight Alpha, daily use in the evening, that's going to promote that sleep. Relaxation, reduced eye strain, enhanced focus. Doing it 3 to 4 times a week, and that's going to aid in systemic recovery from prolonged screen exposure or neurofatigue. And once again, we have to pair it with Neuro-Vision rehabilitation. These things work best when they are paired together. So do some near-far accommodation therapy to maximize their ability to accommodate. Pupillometry and autonomic nervous system assessments. I have a little pupillometer on my phone, and I'll check their pupils. I'll see how they respond to light. And you can do it before you treat them, and you can do it at the end of treatment and see how it changes things. So there's easy ways to measure this nowadays.
So for me, using the Vielight, enhancing the neurovisual rehab, optimizes my ability to be able to do those neurological functions and get that patient better. And so we do energy, it does inflammation control, it does neuroplasticity, and it does that autonomic nervous system regulation. So for me, it's improving that visual motor integration. So while I'm working with that patient can see that they're getting better. As Charles says, it boosts the balance and coordination when we're working with them. And the key thing is we're accelerating the cognitive and functional recovery in all of our patients in concussion, traumatic brain injury, or stroke. So in optimizing the brain, that's how we get vision and vision therapy to help get our patients better. So healing isn't about restoring function, it's about unlocking new potential. And that's the way my patients feel. And so by coordinating Vielight with our neurovisual rehab and hitting those targeted therapies, I'm able to accelerate recovery, resilience, performance. And so the future of neuro rehab is here, and a little bit corny, but let's be ready to take the next step. And I think Vielight and adding that to your neuro rehab therapy would be ideal. Charles?
Yeah, I really can't add much to that. I mean, I think DeAnn said it all there. Once again, it's really, really important that we look at other therapies beside what we learned in school, beside what we're learning at meetings. We really need to kind of take this to the next level. And there's so many new things out there, so many new technologies that are coming down our way. I remember going to a meeting 5 or 6 years ago and learning about brain tap, and we immediately brought it into our practice, and it became a big part of what we do. This last year, we brought in Vielight, and it's enhancing what we're doing. It's making it us better at what we do. It's making the patient get better faster, and once again, if anything we can do like that to enhance a patient's life and get them on the road to recovery faster is good news for the patient.
So Dr. Lim, thank you very much for this opportunity. We appreciate it.
Absolutely, Dr. Lim. Thank you. Thank you and Austin and everybody for inviting us to be here and letting us talk a little bit about what we're obviously very passionate about, and this therapy that can be a great adjunct to what we're already doing.
Thank you so much, both of you. This is really exciting. Actually, a lot of what you had to say to us is not unsurprising, but based on a lot of research that's going on in the University of Utah and Brigham Young University, where we've been looking at athletes and ex-athletes with repetitive head injury, and we've also looked at so-called healthy athletes who are playing football, and the word healthy is in inverted commas, and we've been very fortunate that they've been measuring reaction time, processing speed, mood disorders, cognitive processing, balance, gait, all of the things you're talking about that you've been experiencing. They're not by accident. We can see that there have been 45 ex-athletes and I think 30 football players have gone through these processes. So it's really great to see this in action. Now, I am happy that we've got Dr. Lou Lim here to join us, because many of you who've just come into this and watched this presentation, you're probably thinking to yourselves, well, how does this all work, or why? And we're happy to have Dr. Lou Lim explain a little bit more deeply some of the mechanisms of photobiomodulation and the related research that's actually what's going on beneath the surface to make all this happen.
Thank you, Peter. Well, first of all, this is wonderful work by DeAnn and Charles. The audience need to know that we have nothing to do with all the discoveries. It is just wonderful to hear. I guess what we did was just unleash the tools, and they discovered the stuff that we kind of hope that people will find. We don't actually make the claims until we get regulatory approval for this stuff. So we invest a lot of resources, and I'll show you a little bit later, into doing the research, doing the clinical studies. We have a couple of big clinical trials we plan to eventually take to the FDA for approval, and one of which is traumatic brain injury. But I'd like to share with you what I know. I would Can I share my screen?
You should be able to share now.
Okay. So if I can, okay, first of all, so much has been said by Charles and DeAnn about traumatic brain injury is one of my passions. I think this is an area where we are seeing a lot of traction, a lot of evidence to support the possibilities of photobiomodulation to help with the brain to recover from traumatic brain injury. So this is a complicated title, but what I'm trying to do here is to go into the underlying, call it physiology, patho, as related to the diseases, the physiology behind traumatic brain injury and recovery. It's a long paper, it's pretty detailed, and I just want to take you to this particular chart, a diagram, that that actually Charles covered quite a lot. You know, he talked a lot about neuroinflammation. And, you know, for me, the primary cause of, you know, the primary factor for traumatic brain injury is actually axonal injury, is the axons connect the neurons together and they send signals back and forth. And when you rattle the brain, put it under whether it's a major trauma or repetitive impact, you eventually cause some measure of injury, a lot of inflammation. What Peter mentioned is, you know, this study that's coming out of University of Utah, watch out for it. It's being written up now on college football players and how they have prevented their brains from, you know, being affected by inflammation and the disconnection in the axons over a season. Then the next season, which is like this season, they performed remarkably well, breaking their records, you know, as a college football team over historically. So I think it's to do with helping the brain to be resilient and not be chronically affected by brain injury. But we want to take that and do a much bigger trial and so on. So this is, if you have, yeah, go, it's you know, well, personally, I find going to this research help me a lot to understand. Eventually, what we plan to do is not just looking at alpha gamma. In fact, DeAnn and Charles have done a great job in combining alpha and gamma. I do find that alpha and gamma have their roles in helping with recovery of traumatic brain injury. We've got evidence for dementia, for, you know, Parkinson's, as mentioned by Charles, and a bunch of other things. And then also Charles mentioned about autonomic nervous system, the vagus. I believe, you know, the vagus, when you have an intranasal plus directing to the vagus nerve, that connects. The vagus nerve actually is coming out of the brainstem, so that controls the autonomic nervous system. And I believe it can triangulate that and help with your parasympathetic system restoration and all that. Eventually, I think over time, we're doing a lot in this particular area in trying to personalize treatment protocol for individuals by using artificial intelligence. So we're developing all that. We're trying to break through and see, based on EEG, how we can personalize and get even better outcomes. So that's an idea of what we're doing in traumatic brain injury. And I would like to give the audience an idea about of the mechanisms. Let's see. Are you seeing a new set of slides here?
No, it's only showing the paper.
Oh, what do I do? Let me,
I think you'll have to end share and then share your
yeah, stop
entire.
share. Okay.
Yeah.
Are you seeing this? Do you see slides?
Yep.
Okay, great. Now, we have talked about outcomes and resolution of symptoms and so on. What is it that's happening underneath, and how is this working? This is covered quite a lot in the paper, but I want to very quickly go to, let's go here. Okay, now this looks complicated, but it's actually simplified a lot. This on the right, if you follow my cursor, this blue layer here is actually supposed to represent the skin, the membrane. The light goes through when we use something like near infrared range. We use 810 nanometers. Some people use 1070, which is a little bit longer. We plan to incorporate that sometime in the future with these two wavelengths, but eventually, at the one we're using now, near infrared at 810 gets to the mitochondria, which is kind of represented here. And now it does a few things, one of which is releasing nitric oxide back to the body to relax the blood vessel walls, which you can call it vasodilatation. Among other things it does is, of course, it does ATP, which mitochondria has been most people know what it does. This is the cellular energy. Now the other thing it does is a few processes that lead to the activation of transcription factors, which is helping your genes to express better. Now on the left is the electron transport chain, but I want to simplify it a little bit more. Well, just say that it goes through this the process in the whole thing is the respiratory chain, but the electron transport chain has these various terminals that eventually leads to these physiological outcomes, including eventually the gene transcription factors. But we want to see what it does really, I mean, at a higher level in terms of resolution of symptoms. There are quite a number here. Again, I've covered them all in the paper. This came out of a lot of work that the photobiomodulation field has done over the years. I'll just quickly go through, synaptogenesis, like Charles has alluded to, is, it's increasing the creation of synapses, better functionality of synapses. Angiogenesis is the new blood vessels. Blood flow is anti-inflammation. Cell apoptosis is a cell death, so it is kind of helping to, I would say, manage that better. You can put it together with autophagy, where it's the programming of cell death. Progenitor cells, more to do with the eventually stem cells. And then you've got the neutralization of free radicals, and antioxidants to this superoxide dismutase, the antioxidants and various growth factors and neurotrophins. But you can just summarize in some keywords easier to remember, like growth factors improve blood circulation, anti-inflammation, reduce toxicity, particularly when you have a lot of metabolism, and establishing homeostasis or the balance. Now, this is the one that I wanted to get out of the box a little bit, because the more learned people who wanted to explore more into photobiomodulation starts looking to, hey, does the light really penetrate that deep to get all these outcomes? And then you come across this literature, which is, there's quite a lot of credibility. Say we use 810 nanometers in the near infrared, and the convention is it only penetrates 2 to 3 millimeters, this little. And when you go to a longer wavelength, 950 to 1200, you thought it'll be, penetrate deeper. Computer modeling um, and I'll show you a little bit of some experiments show that it really doesn't penetrate that deep. So what's going on? How can we make a claim that we can treat the whole brain with all these wonderful symptoms? Is it placebo? It doesn't penetrate that deep. So I can go very deep. I'm actually probably going to develop a paper to resolve it. But here's one. You've got a group that comes out and say, you know what, I've done experiments and it's only that shallow in the penetration. So when I go look at how it works, how it penetrates on a lamp head using this measuring instruments, is some kind of spectrometer, on in human skin. Don't ask me how they obtain a human skin. This is a lamp head. It's very, very shallow. And their conclusion is you need really a lot more power, like 10 to 15 watts. Okay, we're talking about milliwatts. 1 watt is 1,000 times. Then we're really talking about 10,000 milliwatts, 15,000 milliwatts to try and get 3 centimeter depth. This is what they believe is necessary to get all these outcomes. And they were looking at depression studies. So what's going on here? Now, I want to show you that you got to remember that people were making mistakes in trying to measure the depth on dead tissues. Dead tissues are just dead tissues. There's a lot going on in a living organism. There is I'll very briefly touch on those, and I'm working on trying to explain it. But let's just look at data. So we are actually we finished collecting data in this study at Baycrest Hospital at the University of Toronto, using the actually fMRI imaging. This is the MRI scanner. Subject here with one laser up the nose and one on the forehead, like this. Now let's look at what we're getting and what kind of power per square centimeter is getting what. I'm showing you here preliminary data that has been presented. So, with respect to all the co-authors and investigators, I will show you what's been presented publicly. But we have a lot more data. So early data has shown this, and this is actually being supported in the paper. There's a lot of analysis being done right now, but this is what I can show. So within 3 minutes, 4 minutes, 5 minutes, with one diode, laser diode in the left intranasal and one on the right, we're seeing extensive global response from the brain. When you measure in terms of cerebral blood flow, and what they use in fMRI very commonly is BOLD, B-O-L-D, or blood oxygen level dependency imaging, which reflect the activity in the brain. Now, again, I go back to your early data. We had two wavelengths, commonly 810 or 808 nanometer and 1064. And we're looking at what is the optimum? Where are we getting this huge brain response? In fact, at 810 nanometers, what we commonly use, and this is just in the nose, we are getting 2.5, more than 2.5% response from the brain when we pulse it at 10 hertz, at only 9 milliwatts. So you don't actually need like 10,000 or 15,000 milliwatts, just 9, you know. And when we compare to transcranial, okay, let's look at 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 uh, at 1064 nanometers. It is at 150 milliwatts, pulsing at 40 hertz, which is gamma. This was alpha. 150 milliwatts, we get a peak. If you put too much power at 250 milliwatts, it's gone negative. Now, there's a window, because less than that, nothing is happening. Very similar results are seen when you do voxel counts, as opposed to the blood oxygen level dependency. Now, the message here is we are getting global and immediate response from the brain in the diffuse manner by only one location here, one location here, much, much lower power. So we don't need a lot. So there's a lot of difference between a live human being, and this is done real time in the scanner versus dead tissues. So I look forward to the eventual publication. So this is a summary. Wavelength, power density, pulse frequency have significant effects. Likely 100 milliwatts per square centimeter is around that is required for transcranial, like on the forehead, and just 9 intranasal. And we have other factors like skin color is also a factor, but that's another matter. It is part of the study. Now, how do we get that? Now, it's very important that in a live person, a lot of things are happening. It'll take quite long, and to try and explain it. And we talked about ATP, mitochondria producing ATP. ATP is actually a neurotransmitter too. So it kind of act like GABA or glutamate, where they have different roles in brain signaling. So it works together with purinergic signaling. These the molecules that are also part of this process, where there are receptors all over the brain that can receive these molecules transported by along with the ATP signaling. We are exploring. We have a study that's happening with University of Calgary in Alberta, looking at the biophoton emission. So we all have, when there's some form of activity, metabolism in your body or the brain, you cannot see it, but with certain cameras you can see, there's like aura in the body, near infrared. But inside the body, it seems that a lot of it is within the ultraviolet, but it also covers red and near infrared. Internally, that seems to be involved in cell-to-cell signaling and eventual signaling. Now, this is hypothetical. We're looking at it. And when you have signals from EEG, like electrophysiology, there is electromagnetism involved, and they're also involved in some way. So that is a very quick suggestion of what is happening in the brain. But it is happening, and it kind of explains why we're getting, this low power, you're getting extensive response. So in the company, we do a lot of studies. We collaborate with many researchers, and we cover many areas. It is available on the website. We do everything from looking at neuromedical indications that cover traumatic brain injury, which is mentioned here. We do quite a lot of work on Alzheimer's and mild cognitive impairment. There are studies done on our devices for Parkinson's. We have completed a study that showed that it helps with brain fog in long COVID, and we are going to take that to get regulatory approval for that indication. So there are, Gavo illness. There are a bunch of other things we're doing. We're doing this other studies, and we got this is upper respiratory tract infection recovery from acute COVID has been approved by Health Canada on the X Plus. To do that now, acute is not a thing anymore. So we're looking at long COVID. There is sports. You will see this coming out of University of Utah, particularly. We're doing quite a lot of work on meditation and try to translate it to, improving the functions of normal brains. There are papers published on this helping with creativity. And what is really quite exciting is looking into the basic science, trying to explain. Like what I've explained to you now is only part of what we know. We have looked into what the effects are on the microtubules, which is they form the support structures for neurons and brain cells. I mentioned fMRI. We've got biomarker studies and a bunch of things. These are indexed with these numbers to where this research are happening. And there are, institution-based research involving easily more than 100 researchers, mainly in North America. So that is my summary. I hope I've not gone too much into too much depth.
Okay, thanks very much, Dr. Lim, for taking us on a bit of a deeper dive. So, Charles or DeAnn, I just wanted to understand, you mentioned you're using our technology in your practice. Are the patients ever taking devices home, or do they leave with them, or is all the treatment in your clinics?
So unfortunately, right now, just because of the cost of the piece of equipment and the fact that the piece of equipment is fairly delicate, it's not very practical to send it home. We do a lot of at-home therapies, and it's amazing how much doesn't come back in its original shape. So there's absolutely no way to send this home with someone. So it is done in the clinic. However, we do encourage people to go to the website and to take a look, and that it is something that they could purchase themselves, and we would teach them and counsel them how to use it. But it's not anything that we can right now have them take out of the clinic and make an assumption they'll bring it back in any type of shape.
Okay.
Similarly to the DeAnn, the same thing. We do most of it in clinic. However, I've had a couple patients come to me say, "Hey, I want to get that," and we'll direct them to the website, and they can purchase it directly on the website.
Yeah, they should also know that there's a discount structure they can get as long as from NORA members become referrers of Vielight. So your members can call us about the referral agreement, and that would probably help ease the pain a little bit there. So please let them get in touch. And yeah, I mean that was the main question, I guess. Where do you see the future of this, and how? I mean, are there any future versions of the technology you wish you could have? I mean, you seem pretty happy with what you got, but are there any missing pieces that we should be thinking about?
For myself personally, actually, I think how most of us come into with certain problems is that we use them ourselves. And so we find that something's happening or occurring for ourselves, and we're wanting to do something to help our brain or help our body do better. Yeah. And that's pretty much how I came off the discovery, is that I wanted better performance for the things that I was doing, and then realized that it translated into being able to use it with my patients. And the third thing for me is I have an opportunity to get a contract with a major sport group, And one of the things we're going to pitch to them is a neurocognitive program in order to help them with their sporting. And part of that programming is going to be your piece of equipment as well.
Well, it might be worth mentioning that I guess a year ago we equipped the Brigham University football team with Vielight devices, and they've been using them through the season. But just FYI, if you look at their performance last year with the same coach and virtually the same team, the same quarterback, and compare it to this year, some of your sports customers might be very encouraged to follow your advice. So,
Yeah, I think certainly, I think I'm still, I would say I'm still in the learning stage with the device. I think as an adjunct to what we're doing, an adjunct to other therapies that they're doing, I think it's another tool in our toolbox, so to speak, to be able to make the patients, improve the patient's lives. So, in looking to the future, I think we'll find out as we learn more about photobiomodulation and what it can do and how it can do it. And I think we'll come up with new applications over time. I think we'll think it through and we'll say, hey, have you thought about doing it this way, or have you thought about doing it this way? But I think that's part of the process of learning as we go through it.
I think the biggest key with the product for our program is, like Charles and I mentioned, is movement. Basically the neocortex was developed because of movement. We walked 12 miles a day, and we were hunters and gatherers, and slowly but surely then our knuckles came up off the ground. So the point is that by adding it to other types of things, it becomes a much better product. So by using eye-hand coordination or vibration or movement, we can find that Vielight really helps us do better with that recovery.
and
thank
wellness. You so much. Absolutely, absolutely. Well, if you have any other questions for our team here, we're going to, you'll see a website address and an info@vielight.com. We'll put up something specifically for NORA, so you can answer questions, and both us and I'm sure Charles and DeAnn will be happy to also help us to get you what you need, information you need. But thank you so much. It was really interesting.
Thank you so much for putting so much effort into preparing for this.
Well, thank you for the opportunity.
Yeah.
Thank you. We appreciate it. It's
Absolutely.
wonderful to have met all of you and to be able to really talk about how this is just once again another tool in our toolbox, and it's been a great addition to what we're doing.
Absolutely.